Go ahead, John.
Good morning, all. This will be a truly interesting session. I am John Hamblin. I'm the founder of Aging to Halifax, which is a chapter of one of the 127 chapters of Aging to around the world. We have people watching from various chapters and from other organizations. And it's a great pleasure for me to introduce this session. The long title of the session is The Use of Flexible Tech in the New Healthcare Landscape. I think everyone there, it'd be hard not to recognize, no matter where you are in the world, that the landscape has definitely changed, and we need to change with it. That is really the main mission of this conference, both in terms of highlighting innovative companies that have started making changes or have made dramatic changes over the last 6 months, and also highlighting specific applications that have been made in a wide variety of areas. We're very fortunate to have the speaker for this session is Jennifer Bowers. She's the Clinical Product Director of Get Real Health. She's a longtime caregiver with more than 20 years as a nurse in oncology and other areas. So she speaks from personal experience. She has mentioned to me before that she's truly committed to helping caregivers and the elderly to live better. Get Real Health specializes in using technology to assist individuals to better manage their health. They have a presence throughout the US and elsewhere in Canada. And one of the reasons that I have Jennifer talking today is they're looking to open up in Atlantic Canada in the near future. And we're looking at helping them through our Nova Scotia Living Lab that we're establishing and through the Aging 2 group. I welcome Jennifer to tell you about a system that truly supports the elderly population and can readily pivot to meet the constantly changing needs of our new world. If you have any questions, feel free to enter them through the Q&A at the bottom of the screen, and I will examine them and pass them on to Jennifer at the end of the session. Jennifer, it's all yours.
Great, thank you, John, and good morning to all of you. John spoke to the fact that I have a lot of personal experience, not only as a caregiver, also a family caregiver, but in addition, 2 years ago, I was diagnosed with cancer myself and became a patient and part of this crazy world of healthcare, trying to manage my own health and kind of bringing together my data, and it's become that much more important to me, and I have that much more of a passion about it now. So just a little bit of an agenda, just a little bit about who we are at Get Real Health, what we've done and where we've done it, what we've done for elder care. I'm going to give you a little live demo of one of our tools, and then we're going to talk a little bit about how we pivoted for the current pandemic. A little bit about Get Real Health. So our goal is really to bring a lifelong health record for a patient. So imagine a parent with a young child being able to see their health care and their immunizations. And then when that child grows up and goes off to college, they can carry that data with them with their own record. And wherever they then move along to, they can then carry that and add on their partner, their children, or whomever they would like. So really putting that data into the hands of the patients for the patients to use in a way that they want to, but also giving the providers a 360-degree view of patients. Being able to see that information from home and between their visits is so important in healthcare. This is just really quick where we are in the world. We were purchased recently by a company named CPSI, who holds many of the EMRs in the United States, hence all of the dots more recently in the United States. We are a partner of TELUS in Canada, and we'll talk about that a little bit in a moment. We are also in multiple hospital systems in Great Britain and definitely have some presence in Asia and Australia and New Zealand. This is just very quick, some of our key clients. I'm not going to really spend any time on this, but we really do have clients that are as small clinics and as large as provinces. So we can really service as many people or as few people as our clients need. So our two main products are Instant PHR, which is the patient and provider facing tool that you're going to see a demonstration of. Our second product is called CHBase, and that's a data repository to bring all of that data together. And really my dream, and a lot of people's dream, is to be able to bring everybody's data together in one place and then allow the patient to be able to choose with which apps they want to see their data. I'd love it if it was Instant PHR, but if it's not, that's fine too. I really just want to make sure patients see their data in the way that makes the most sense to them. So what we're able to do on top of CHBase is build different applications. So a patient portal maybe, a care management application, and maybe a baby health app. All of these things we've done within Canada with TELUS, which we'll again talk about in a moment. But then all of that information sits below in CHBase. So if I just am a healthy person using the patient portal and getting my data there, but then I have an incident of something that I want to look at, maybe the cancer diagnosis, I want to use a cancer app or the care management app, I can then pull that data out of CHBase and populate that particular app. So my data under my control follows me where I want to be. Again, this is not my forte of technology, but I always like to show this because our goal, again, is just to open up for as much data as we can get, whether it's from devices or hospital systems or HIEs or patients entering their own data. The key is that everything we do is sourced, so everybody knows where that data is coming from. And in addition to that, the patient gets to choose with whom they want to share that data. And maybe it's not just sharing that data. Maybe it's giving access to a family member who they want to help them with their care. Last night even, I was in two of my mother's different patient portals analyzing her lab results for her. Now she had to give me her credentials, but imagine a world where I could use my own credentials to not only manage my care, but with her permission, see her data all on one site. So that's what we have actually. Security, absolutely secure. Since we are around the world, we do make sure that we hit all of the security and interoperability standards in all of the countries we are in. So we won't really go much into that. So Instant PHR, and this is what I'm going to show you a demo of. So I don't necessarily think we have to spend a lot of time on slides here. I really much prefer walking people through a demo. It's much more interesting. But just a couple of the things that we can do in Instant PHR. Number one, we are agnostic to the type of device that you're using to view your data. So if you want to see it on an app, if you want to see it on a tablet, or if you want to see it on a desktop, you can. One of the pushbacks that we get with the elderly, which always amazes me, is they don't understand technology. Well, ask John about that. He certainly understands technology. My mother was the first person that I ever knew with an iPhone. My 94-year-old father-in-law uses a tablet for everything he does. So yes, anywhere we look in a population, there's going to be certain people, whether it's because of geographic reasons or age-related reasons or knowledge reasons, that they can't get access or don't have access. But even if we're touching 70 to 80% of people in a population, we can do such good by helping them manage their care outside and in between individual care points. So some of the things that we can do: multiple EMR facility solutions. So again, bringing data in from different healthcare systems for a patient, helping them manage their chronic diseases, remotely managing patients in their home, using devices, using blood pressure cuffs, weight scales, all of those, and wellness apps, Fitbit, things like that, to bring data together to help patients understand correlations in their care. Certainly video conferencing, and we'll talk a little bit about that in the end, and how we, or at the end of the speech, and how we pivoted during this pandemic. Wellness initiatives, absolutely using the tool to give patient educational material, shared decision making, allowing patients to own their data and decide with whom they want to share and communicate. Multilingual capabilities, and this is something that's gotten us around the world, is that we built the tool in such a way that a patient can toggle in between languages. So one tool, one application can be built in multiple different languages for a patient to be able to decide what makes the most sense for them. And then use case specific solutions. So again, if you're looking at a baby app or a wellness app, or an app for the elderly, we can do them all on top of that database. And so patients can carry that information along with them. So what we'll see here is taking those different screenshots we saw and seeing them in the ways that we can show in different interfaces. So the mobile app, absolutely key. Everything we design for mobile first. So patients can get push notifications to remind them to do things like take their medication, remind them to get on that weight scale if they're managing congestive heart failure at home, all of those things, reminders about appointments. And then the patient web portal. So if they're using their desktop, they certainly have that ability, and all the tools carry through. What we're seeing on the right-hand side in the tablet, just to show you what it looks like in a tablet, is the provider dashboard. And we can certainly stand up our provider dashboard, but we can also integrate all of our provider tools into an already functioning provider interface so that providers don't have to have multiple interfaces, which enhances any provider's workflow. I'm not going to show any more about Instant PHR, like I said, because I'm going to give you an actual demonstration of it. But for CH-based, it's a little harder to demonstrate since it is, it's the database underneath. So what it does is bring in all of that data, whether it's provincial health authorities or hospital systems, the pharmacies, health registries, could also be pharmaceutical companies doing research. So patients can then choose which sites they want to connect with and share that information. So we also provide open APIs for third-party developers, and we encourage developers to develop tools onto CHBase. We have certainly a packet of teaching them how to do that, but in addition, all that security layer, so a patient always then has to authorize any app. But what a great thing. We know we're not going to come up with every cool new app that is out there. What we want to provide is the ability for all of those apps to come together in one place. So who does CHBase benefit? So for the patient, you can bring all of your health data together. So instead of having information in disparate systems, the patient can own one record to bring all of that data together and use it in the way they want to and share it with whom they want to. For the providers, a 360-degree view of patients. So oftentimes, and I can tell you this as a care provider in oncology, I would see a patient every 3 weeks. What happened at home in between? Generally, they didn't feel very well, so they didn't necessarily remember that, what days they were having symptoms. And we used to send them home with a piece of paper and a calendar and say, document your side effects here, because we then dose their medications based on those from home. But a lot of that was missed. Giving them a tool that they can, and again, I'm going back to the patient benefits, but it's also the provider benefits, giving them a tool that they can check off and keep track of a journal of their symptoms, whether it's for oncology or congestive heart failure or any use case, is so helpful for not just the patient, but the provider. Developer benefits, I touched on a little bit. We do allow them to develop tools and apps right onto CHBase. We are, again, security compliant all over the world. And then organizational benefits. You can use all of that data to then figure out what's going on in your population. Again, always with patient consent. Hospital systems can use data for marketing. They can send data out through the portal about their organization, keeping patients loyal to their organization. The next slide, if I can get it moving forward again, is just a few things that CHBase can do. It is a unified data platform, multiple interfaces for bringing in data and then pushing out data to where a patient wants to have it go to. We can use this information for analytic purposes. One of the greatest things is all of that data being used for research to help figure out solutions for diseases and treatments for diseases. So great to be able to bring all of that data together in one place. We've talked about the open APIs, patients being in control. One of the other things is all of that data gets reconciled within CHbase. So you're not going to have multiple postings of the same medication over and over and over again. So that's all of that more technical aspects. So what have we done in Canada? So CHbase in Canada is TELUS Health Space. TELUS is a partner of ours in Canada. And what we've done with them is taken an application of CHbase and made that into TELUS Health Space, which you may or may not have heard of. What sits on top of that are different provinces, Alberta, Saskatchewan, have their own instance of instant PHR that sits on top of that. So all of that data feeds into their CHbase. So if a patient moves from one province to another, they can bring that data with them. In addition, large EMRs are attached to that. Clinics, we have done work with a very large clinic in Canada to bring all of their data together too. We've also done work in the mental health and put together a mental health application within Canada to really help that population. And we did a study on that one and really was quite amazing, kept people much more compliant to their appointments, decreased emergency room visits, and decreased arrests of the population. So a lot of things that can be done by giving people the tools that they need, where they need them, and when they need them. So what have we done so far with the elderly population, and what can we do? Let's talk a little bit about what we know about the elderly population. And I said this before, the population is not given the credit that it deserves for understanding technology. What person in the elderly community at this point hasn't worked with technology potentially in their career at this point? So just to some of the stats, and I apologize that some of them are US stats because that's where we're from, you know, we've got 80% of adults 65 and older who use a cell phone. And then it breaks down with the age. So 80 plus in the age is still 58% of people we can capture. 70% of seniors are connected to the internet. It's still a lot of people that we can touch at the end of a day. So instead of writing off a whole population, how better is it to just get to the people we can and help grow on that? So what can we do to build? So this Legos that we've been kind of showing to build these different applications with that CHbase on the bottom, we take our different Legos to build the tools that we need to support the population. So for the elderly, secure messaging to communicate with their providers, plans of care to help them understand and care for themselves at home, whether it's reminders to take their medications or task to step on a scale every morning to feed that data into their tool. Emergency contact lists, appointment reminders, and an appointment schedule. I know my mother was just going over with me last night her list of appointments that she has for this month, and it's frankly amazing, and people need to be able to keep track of that. The ability to share their record and give someone the ability to help them manage their record, and also give them the insight to say, hey, I noticed you didn't do the task to take your medication today. What's going on? Video consultation. How important is it to actually be able to just see a patient's face? My father-in-law was saying that, you know, he doesn't understand the benefit of these video conferencing. People can't listen to my lungs and listen to my heart and such. And I said, as a practitioner, how important it is just to see a patient's face. There's so much that you can tell by actually seeing a patient's face while you're speaking with them. So just being able to have that is very important in this population. Emergency access. So being able to have a provider gain access to a patient's record in the case of an emergency. We do have that set up in our tool to be able to break the glass and give somebody emergency access. Medication reminders. How key is that? I know I need reminders constantly to remember to take my medications. I know that's going to get harder for me. So being able to have pop-ups. We've done some work with smart apps, some that we actually did some work with Alexa at one point, and would love to do more with devices like that to say, hey, good morning, remember to take your medications. So that's definitely something on the horizon. And in addition to that, being able to bring in the biometric data, the blood pressure, the blood glucoses, to be able to bring everything together in one place. So it's just kind of an example of how we can meet the use case of the elderly population. And again, keeping in mind that every installation that we do is a little different based on the use case. What we see from our competitors and other people on the market is they have a one build for every single person. And it's very concrete, and what might work for somebody who's 20 isn't going to work for somebody who's 80, and vice versa. So being able to change and bend and be flexible is key. And the other thing is, which we can talk about a little bit when we get to the COVID, is that being able to stand up an instance like this and then get feedback and say, well, you know what else would be really important to me is a journal to add things, to talk about my symptoms, and those are tools that we have that are in our out of the box solution and can just be added. Just so we add another Lego to the pile here, very easily without development. So we can grow as you grow and as the needs of the community grow. This is kind of a busy slide, so I apologize. In addition to it being a busy slide, it's in a different language. So if you can read it, kudos to you. But this is just an example of something we've done in the Netherlands. We did a pilot in palliative care. Of course, I can tell you as an oncology nurse, palliative care is so important to try to help reach those people in a very important time in their life, which is the end of their life. One of the issues that we found in this population is, of course, that we had trouble getting patients to stay with it for a long time to do the study. So we relied so much on family members to be able to have the access to the care to help manage their family members' care at the end of their life. And it's something that's ongoing that we've done in the Netherlands, and we've now built on that and are doing more use cases within that country, building again on one instance of CHbase. All right, so this is the point where I am going to go into a little demonstration. So bear with me a moment. I'm going to stop sharing this screen and I'm going to bring up the screen of the demo site that I'm going to show. I will bring us back to the slides after the demo to just show you a couple slides of what we did when COVID hit. So bear with me one moment. I'll stop sharing this screen. And bring this screen up. I have 3 screens in front of me, so talk about technology. All right, so this is our current demo site, and I will say that when we stand up a demo site for any of our use cases, we generally try to start simply. This is a demo site that I use across the board for whatever use case I'm demoing to. So it does seem a little busier and have a lot more tools than we would necessarily suggest for just starting out. But there's some key functionality. One is the ease of use. And this is something that is so important. And again, depending on the use case, you'll see here these little tiles. These are really meant to give somebody an indication of something that's important to see: their most recent blood glucose, their most recent weight, their most recent blood glucose, and what tasks for their care plan they have to complete today. And these are just links to get them to that information. So the goal in the ease of use is to not just make it friendly, colorful, it's to help patients decrease the amount of time, the amount of clicks, the amount of work they need to do to see and use the data that is important to them. Being able to present things in easy graphical formats. And one of the keys in healthcare is being able to help patients understand the correlations between certain things. So being able to put multiple metrics on one graph so that patients might be able to see what their blood glucose readings do in relation to their weight. So we give patients the ability to toggle on and toggle off different aspects. So here you can see that their weight's pretty steady, their blood glucose is going up and down, so that they can look at different things and correlate those data points. Again, showing things in that historical view and is also very important in lab results. So if we click on one particular lab results, in this case, it's a liver function test, and it shows the most recent liver function test. But then when you click on it, you can see in historical way your previous readings and how they've gone up or gone down. In addition to that, educational content to be able to allow patients to understand what this particular lab test means and what it might mean to them, and what an elevated reading means to them. So giving them very targeted educational material is very important also. It also keeps them in one site and keeps them from having to search on the internet and maybe not getting the most trusted information. Again, these tiles here will get us to further information, which I will show you. But in addition to that, we can use the tiles to give you the ability to link out to more educational content, whether it's a video on breathing exercises or giving you further information about coronavirus, just using easy, quick links to allow patients to get to where they need to go. Secure messaging. I don't spend a lot of time on that because it's something that is base tool. It is completely secure to connect with your whole care team or with an individual provider, attaching an image maybe. If you're managing something at home, certainly if you're using your mobile device, you can take an image of a wound, or especially if you've fallen and you have a scrape, do I need to come in to have this seen, or can I do this at, can you give me some advice from home what to do with that? So being able to, again, show a picture, connect with a video conference, very important. If we go ahead and get to the task page, so these are the simple tasks that tell patients what they need to do on a daily basis. One of the things that I would say is that patients can certainly manually enter this information. They can send a message in relation to, if they're confused as to why I'm doing this or what this means. They can set a reminder around any of the tasks. But if they have a connected device as simple as a scale, and all they're doing to connect to that device, the way I talk about it is, if you have a Withings scale, which is one of the ecosystems that we connect with, if you have a Withings scale, you have a Withings account, you have a Withings app, all you have to do is click on the Withings image in our portal, log into your Withings account, and again, allow that access just by clicking on I allow my data to be shared, and then that data will automatically flow. So having a task that says check your weight in the morning, you step on the scale that is connected, that data just flows into the tool. We'll show you on that graph that we looked at on the home page. If there is an alert that a provider has set up, potentially, again, congestive heart failure, you want to know if the weight's gone up 3 pounds overnight, 10 pounds in a week, to intervene early to keep patients from needing more expensive, more acute care. If it meets the threshold for that alert, the alert will be sent to the provider. But in addition, it checks off the task for the patient. So again, limiting the time the patient has to actually spend in the tool. It'll take care of that for them. We have the ability to allow patients to answer questions, complete surveys. So whether or not these are those health risk or those health forms every time you go to a provider's appointment that you have to fill out about how you've been feeling, that information you can do at home, fill it out. Then your provider has access before your appointment, whether it's a virtual visit or whether you're actually going into the appointment. In addition to that, if it's potentially, and as we pointed out, I'm an oncology nurse, so a lot of the things that I do in the demo site have to do with oncology. This is a survey asking patients about their symptoms at home in between their chemotherapy sessions so that they can track that information. So what you'll see here is branch logic. If the patient says, do you have nausea, and you answer no, you'll see below that nothing changes. If I change that answer, the questions change. In addition to that, only surfacing certain questions to certain demographics. So only males get certain questions and females get other questions, making it easy for the building of those surveys that we've made as simple as possible within the tool. In addition to that, we've given our back end a lot of flexibility using those Legos to build different installations for different use cases. We wanted to also allow for patients to have some say in what they wanted their site to look like and what tools they wanted up front. So we created a patient dashboard. And this is using those tiles that we saw on the home page. And if we click just edit display, it will pop up all tiles that are available within the site, and they can choose what they want to have. Now we can surface the dashboard as a home page. We can surface it as an internal page, whatever makes the most sense. Patients can then just drag and drop depending on where they want those tools to be laid out on their dashboard, and then just save the display, and that becomes their dashboard. So again, instead of having one concrete look and feel for every application, the key is to be flexible. The key is to be able to allow not just the business use cases for our clients, but also the patients and their caregivers to be able to have some flexibility within the tool. If we go back to the home page, I want to show you a little bit about, I know we looked at this graph, but I want to show you a little bit more of the biometric information and how that displays. So I'm going to go ahead and click on the blood pressure. A lot of people manage their blood pressure at home. A lot of people have cuffs at home. Some of them are Wi-Fi enabled and can connect to the system. Some aren't. Sometimes you'll use one that is, sometimes you won't. Maybe you go to the pharmacy or the grocery store and you use their blood pressure cuff, or you go to your provider's office and use theirs. Being able to bring all that information together is really, really important. But equally as important to that is being able to tag or source all of that information so that as a patient and then as a provider, you can see where that data came from. So you can see whether or not it's trusted data. What you'll see here for this example in blood pressure, again, if you highlight or just scroll over, you can see the individual readings. You can toggle on and toggle off if you just want to look at the systolic or if you want to look at both. Trying to use very simple iconography to allow patients to see what's in and out of range. But again, that's source. So you'll know if it's self-entered or if you know that it came from a particular device. So you'll know if it's more trusted. And I can tell you as a practitioner how important this is to be able to then diagnose and treat a patient if you know that that data is more trusted data. I am actually going to come back, I think, to the slides at this point. I wanted to give you a look and feel of what the Instant PHR tool really looks like and speak to that flexibility. I always think it's key to be able to show something live, to be able to get people, have people understand that it is a working, functioning tool. And actually, you can Google online to see the actual installations. Certainly in Alberta, I know it was in the news last week, I believe, our installation for their patient portal there. I'm going to go ahead and stop sharing and bring back up the slides to share that. So bear with me again one moment. I'm just going to put my, my slides show back into presentation and make sure I'm sharing that screen again and move on. Okay, so what did we do during the pandemic? All of a sudden, pandemic comes. Actually, let me back up, I apologize. Let's talk a little bit more about telehealth pre, during, and post-pandemic. So before COVID, how many people really had the video visits? It wasn't something that was readily used. I run the product within Get Real Health, and we had video conferencing on our roadmap for the end of this year. We hadn't planned on it. We hadn't had a lot of people asking for it before then, but we were going to build it by the end of this year. When COVID came, we clearly had to move that up. Because we hadn't had a lot of people looking at it, you can see 25% of respondents had used telehealth, so that's not a huge number. This is during COVID. 59% reported they're more likely to use telehealth services now than previously. So a lot more adoption. In fact, all of my appointments, most of my appointments are still virtual. And then telehealth post and during this phase of COVID that we're in, people are actually changing their physicians if they don't have video or remote monitoring available. So you can see Dr. Smith's office here doesn't offer telehealth. So this patient is saying, goodbye, I'm finding another provider to help me with my care. So what did we do? Breaking news, COVID outbreak. It was declared a pandemic. This actually all occurred on a Saturday morning with some phone calls that occurred here in my kitchen. I got a phone call from the CEO of our company that said, we got to do something. So we all jumped on the bandwagon over the weekend. We stood up, we worked to stand up an idea for a site. So we whiteboarded a little bit. We decided what we needed to do. We already have this huge arsenal of tools, or a huge arsenal of Legos, a big bucket of Legos that we keep. So we went through and we picked out the things that made the most sense. Now, over the next few days, we put it into an app. A little further down the line, we were told by our clients that it's not just that they want to be able to assess COVID patients. What they really need is to be able to touch those chronic care patients, the elderly patients, the people who are immunocompromised. Those are the people they want to reach. So we added some more tools to allow for that use case. And in 16 days, we launched an application called Talk with Your Doc for patients to be able to communicate with providers, be able to upload their biometric data, to be able to answer questionnaires about their symptoms, to be able to get educational content. So it's just an example of how quickly we can use our already built tools to stand up a tool and pivot during something like a pandemic. This is what Talk with Your Doc came out looking like. Certainly we took the video visit appointments, which were obviously key to this, but we wanted to make sure that both the patient and the provider were getting the most that they could out of it. So a couple of things that we did for the video conferencing, many video conferences I've been on for healthcare, they make you download another system. And that can be very hard for people to be able to follow that that workflow. So one of the things that was really important to us was to be able to come up with a system that allowed a patient, you can see a join button here, to be able to click a join button and just have the video visit come up without having to download anything, without having to do anything else besides that. So that's one of the things that we built. One of the other things we wanted to make sure we did is to be able to have some general medical information or medical history within the site, because it could be, and it turned out that it was, that many people have started talking to providers that they've never talked to before. So you want to be able to have at least your medication list, your conditions list, any allergies you have, medications past and present, like what you've used before, and a questionnaire to get a little bit of your health history and maybe some questions about your current symptoms. One of the questionnaires that we built was about COVID symptoms. Do you have a fever? Do you have a cough? All of those important questions that a provider is going to want to know beforehand. So we baked that all into the tool. And again, 16 days later, we had a tool, and that's what we did to pivot. So I'm actually going to go to questions now, but I just really want to say thank you. I hope I was able to kind of walk through that idea in the beginning of telling you a little bit about who we are, what we do for the elderly population, why it's important to be so flexible with your tools and what you can offer, but also because of that flexibility, how quickly we can pivot in times of need for our patients. So John, any questions we have going on here?
Yes, we do have one really interesting, one which had occurred to me as well. So we'll start with the first question. What has been the reaction from the physician and hospital community to giving healthcare consumers a direct voice in their own care through the PHR?
Yep, that is actually a great question, and the answer varies. It depends, we've found, on the use case, on the geography, how rural the patients are. The more rural the patients are, the more likely the providers are going to want the patients to be able to contribute because they can't see them between visits. Our hospital systems have always been very interested in being able to gather that information. It has absolutely been more of a push for providers. Although what we've seen during the COVID time is that they're looking for more and more and more of that data. Their issue mostly, and I know a lot of this comes from the attorneys, is that they're not sure of where the legality of what they're responsible for is. So there just has to be very good wording about that. You know, your provider may not see this information for 72 hours, or in some of our cases, our patients have access to the Instant PHR tool and can upload their information, but only certain data points get pushed to the provider. And there's definitely good wording about that. But the key again is having that information sourced so the provider always knows which data point is coming from whom. But I will say last year, my answer would have been much different. It would have been, it's a constant fight with providers. But now that we're in this time where providers want the remote care going on too, they are much more open, we have seen, to gathering this patient data.
Okay, I actually have a sort of a follow-up question that
Sure.
on the same topic. I guess, you know, I personally am working on a couple of big projects here in Nova Scotia where we have Dalhousie University and their researchers heavily involved, and as well several different ethics committees and groups. And I guess the biggest single concern of people is how secure is the data and how securely is it kept. And I don't want you to go into great lengths about it, but you know,
Sure.
certainly there are the PIPEDA standards in Canada and US, etc.
Yeah.
How control the data?
Yeah, one of the things that we learned being an international company is that you have to learn a lot about other countries, which has been great. And we have, before we've gone into any other country, had to do a lot of research and work with our partners. We always have partners in our other countries to learn about the security standards. One of the things that we have learned, certainly overseas, in Europe, especially, they don't want any data stored in the United States, which is certainly understandable. So we've set up a data store in the Netherlands. We've also, speaking of the Netherlands, they have their own security standards that need to be met. So we always work with our partners within the countries to learn what those are. And truthfully, when you do that, you learn that a lot of people's security standards are the same. So maybe there's just little tweaks that have to be done to be certified within other countries, is what we've kind of found along the way, that it's just little tweaks to be made, if anything, to be certified for whether it's high tech or ISO in different countries, or the security measures in Canada. But one of the things is that when you start to give patients the control of their data, patients can share data with whomever they choose. That's one of the great things in the US with HIPAA. I can share my data with the mailman if I want to. If my provider did, they'd be in a lot of trouble. But if I'm choosing who I want to share it with, then it definitely helps with those security issues. In addition, we follow all the other security issues that the cell phones follow. We allow patients to use fingerprints, PIN numbers to get into the application. And any information that we send out in push notifications or emails doesn't have any patient data within those. It forces the patient to come back into the tool to see any of that protected patient data.
Okay, I have one other question that came in recently, which has to do with application developers. What is done to provide resources to other app developers who want to interface to your software? Do you provide a sandbox and a developer environment, or simply API links?
We absolutely do. We have a website that I can get to John to disseminate to everybody if you'd like. I want to say it's developer.instantphr.com. I should know that by heart. But it is an environment for developers to go in and learn how to build within CHBase or on top of CHBase. our whole point is we want to encourage that. So that's why we have all of that information open and accessible to anybody who wants to see it. So come on board. Anybody who has new cool apps, we'd love to see them.
That is great. I guess just one other general comment is I work a lot with government agencies throughout Canada, and there definitely is a real aversion to anything that involves storage in the US, as well as because of some of the rules and regulations started out through Homeland Security or whatever.
Yes.
What most are insisting on is that
I'm not sure if John just froze or if we lost him or the whole thing.
No,
I will jump.
we just
Okay,
lost
there.
John for a second there.
Okay, I'll jump in there for a minute. It's absolutely true and understandable that other countries want to have their own data. So we have a lot of options. We do store our data. We can store our data in the cloud, in any cloud storage area within your own country. We can also set up the system on-prem. So we have been able to, and this is how we've been able to become international. We don't want to take your data. We don't want to store your data. We don't want to keep your data. We want to be able to have you keep it within your country. And that's what we've done all around for all of our customers, is given them the abilities to keep their data within their own country limits. I think without John, we've probably missed any, I think we got the questions, it sounded like, from him. And I think we're just about at time. And I don't know, I know that John would transition probably at this point. But I don't know, Wes, do we just transition on to the next person at this point then?
Yes, so all the Q&A is wrapped up, Jennifer. So thank you so much. Folks, if you do have follow-up questions for Jennifer, make sure to reach out to her in the networking function of FeedLoop, and you can message her there and ask follow-up questions. The next session will be starting at 8 o'clock. Well, that's my time, so 11 o'clock your guys' time in Halifax. So Jennifer, thank you so much for a great presentation. Very well done.
All right. Thank you, everybody. Take care. Enjoy the conference.